Hey guys, this is Josh Nelson from Nelson Elder Care Law. We just want to jump on with you today for a little learning session. So, if anybody wants to wait until we have a couple of questions coming in, what we're going to be talking about today is Medicaid and how that plays along with long term care, what the program covers, what it doesn't cover, what happens if something gets sick, they need somebody to come in their home. Does Medicaid cover that? What's the difference between Medicare, Medicaid, things along those lines? So I appreciate you guys jumping on with us here. We're just going to wait for a couple more people to set in, and then we'll go ahead and get started. One of the things that most people are really confused about is the difference between Medicare and Medicaid. And so, one of the best examples we like to use to explain against the differences is that Medicare is an insurance that you've paid into, and as long as you paid into it or you qualify through other means, you can get access to it once you reach 65. It's really important, even if you don't need it right whenever you first turn 65, to go ahead and register for it, because otherwise it gets a lot more expensive later on whenever you do want to switch over. But Medicare is just like the normal health insurance you've had throughout your career that makes it so that if you're sick, they pay a portion of it to try and get you better. There's also supplements and other things that are beyond the scope of what we're going to talk about today. If you have questions about it or you feel like you're paying way too much for prescriptions or coverage, there's Medicare brokers that can help walk you through that process during open enrollment to really make sure you get what you need and that your specific circumstances are being covered. A lot of times, whenever we work with families that come in, we find out, just like this morning, that a lady's paying nearly $5,000 in prescription costs every 6 months. If she has a different plan that covers her prescriptions better, she can actually get that down to almost $200 a month. And that's pretty crazy to think of. She was well off, but not necessarily wealthy. And whenever you look at her fixed income and paying so much of that towards prescription costs, I think that's a lot of the things that seniors face whenever they're going through the process. And she just signed up through the healthcare marketplace for a plan that she thought was good, but because she didn't sit through with anybody, she just didn't map out exactly her prescriptions and her medical costs. So she is covered, but probably not covered well. And whenever we start talking about what that looks like, a Medicare broker is the person that you would ask those questions to. That's not something that comes to an attorney. They should have named the program something different rather than Medicare and Medicaid because even people in the industry tend to get them slightly confused. They are not interchangeable by any means. Like we talked about, Medicare is like health insurance. Medicaid is more like long-term care insurance. It's not a program that you've paid into. It's a government subsidy program that allows for, if you meet certain requirements, you can get certain care. The majority of Medicaid that we talk about in the context of elder law or whenever dealing with seniors or people with disabilities is going to be talking about what's called nursing home Medicaid. Sometimes you'll also hear it referred to as ABD Medicaid, which stands for aged, blind, or disabled Medicaid. There are also some in-home Medicaid waiver programs. Sometimes if you have income under a certain threshold, usually less than $1,200 a month of total income, you can qualify for waivers. And this is where a lot of people get confused. Some of those Medicaid waivers pay for Medicare premium costs. If they couldn't confuse it enough, that definitely doesn't help things. So we want to make sure that we're being clear on exactly what we're talking about today. We're not talking about Medicaid waivers for Medicare, and we're not talking about Medicare. We're going to be talking specifically about Medicaid as it pertains to seniors. There's also Medicaid that's eligible for younger people as well, especially single mothers or people with disabled children or people that are coming out of a disability program, coming off of it and going back to work. Those are going to be outside the scope of what we discussed today. Going forward, we're going to break it up into a couple different sections. The first is just Medicaid in general, asking questions about it. What happens? How do I qualify? Do I have to be bankrupt? Do I have to be broke? If I'm married, what happens to my spouse? If I don't like that, can I divorce my spouse? What happens along those lines? Also, what does it cover? And so, like we said, the Medicaid we're discussing is similar to long term care insurance, but it doesn't cover everything long term care insurance covers. So, if you have long term care insurance, a lot of times it can cover things such as people coming into your home, going to an assisted living, or also covering what we call skilled nursing facilities, what's commonly referred to as a nursing home. In order to qualify for Medicaid, that's just going to be the skilled nursing portion. Again, there are some waiver programs that will allow for a couple of in home breaks. Sometimes it's transportation, whether that be medically needy transportation, sometimes it's non medical transportation, just going to doctor's appointments. The state has a certain number of waivers that they release each year in order for these programs to be what they call fully funded. And so those lists fill up fast, unfortunately. I will tell you that right now, some of those open spots are available. And so if you feel like you need a little extra help, it can be something that helps you out. Also, if you're under the age of 65, there's a program called SSI, or Supplemental Security Income, which is also run by the same people. And if you have questions about that, we're glad to do another live about it. But today we're going to focus specifically on Medicaid as it pertains to some of the waivers for in-home, but mainly for nursing home care, or what's called ABD, aged, blind, and disabled. Everybody starts out these conversations saying, I don't want to go to a nursing home, or I don't want my loved one to go to a nursing home, especially a Medicaid nursing home, because that's way worse. I want to clear that up and just say that in the state of Georgia, almost all of the nursing homes accept Medicaid. The only difference between what happens with a Medicaid bed versus what's called a private pay bed, or somebody that's paying out of pocket, is that that private pay bed costs significantly more. And so with Medicaid, the state, actually through a federal program, will reimburse the skilled nursing facility for that 24/7 around the clock care that you or your loved one need. A lot of times, people are able to stay somewhere like an assisted living, which is a lot different than a skilled nursing facility, but it also costs more and you have to private pay for those. Whenever we start talking about the skilled nursing facility, it's for whenever people have severe cognitive impairment, whenever they have mobility issues. Even if you have the funds available to stay in assisted living, there are some health maladies that can come up that make it so that you can't legally stay there because the properties aren't licensed for that level of care. A lot of times we think about it, as you can see, I'm a bigger guy, and if I really had some mobility issues, it would be almost impossible for one person to help me if I was dead weight. So even though I'm a little bit younger, if I did have to go to an assisted living because of a mobility issue, I could be just one small little fall away from needing to go to a long-term care skilled nursing, just because due to fire code, they wouldn't be able to keep me at an assisted living. The staff to patient ratio is generally going to be higher with a skilled nursing facility, and a lot of that goes into where the cost increases are. Around Georgia, and especially in Cherokee and Cobb County, most assisted living rooms start somewhere around $3,000 to $3,500 and go up to around $6,500 to $7,000, depending on what level of care you need, what all they're doing for you, and what size your room is. Whenever we start talking about transitioning to skilled nursing, the average rate is somewhere between $260 to $320 a day, depending on where you go. And whenever we talk about it on a daily rate like that, some people think it sounds extreme and some people don't, because it's only a couple $100. But remember that it's a couple $100 at 30 days in a month. And so you're looking at somewhere between $8,000 to $9,000 a month for this level of care. That's pretty crazy to think about. The average Social Security recipient only receives about $1,500 a month. And so if you do the quick math on that, you're somewhere between $7,000 to $7,500 a month shortfall. What that means is that that money's coming out of savings. We always joke that there's a couple ways to pay for long-term care, and I think that's one of the things that people don't focus on whenever they do planning, is that if you don't qualify for some of these government subsidies or these government benefits to pay for the care, the money's still got to come from somewhere. And so that money can come from your own savings, if you have some. If you spend through that or you don't have enough to start with, that's unfortunately whenever it often comes from family members. This is that really uncomfortable story that you hear about where parents have to reach out to their children to get some extra assistance. Often, the kids, even if they are in a position to do it, make it so that it's very hard for them to keep up with their peers and for planning for their retirement. And it starts a real cyclical problem inside the family. Otherwise, we always like to say that there's that rich uncle that we've never met that passes and leaves us some kind of inheritance. Unfortunately, those stories are pretty rare as we continue to age. And then the last option is again some kind of long-term care insurance or something along those lines. Most people, by the time they get to the stage of needing that skilled nursing, aren't going to be underwritable or they can't get the kind of insurance they would need to pay for it. Whenever we start talking about the other option, then it's some kind of government benefit. And so there's a lot of veterans benefits out there that can help pay for that. If you or your spouse was a veteran, we definitely need to cover that topic, but today we're going to not include that in the scope of our conversation. The other option is going to be Medicaid, which again allows for the state through a federal program to pay for that 24-hour care. So rather than you having to come out of pocket for that $8,000, $9,000 a month, it can be the state that subsidizes that for you. What does it take to get there? From the financial side, if you're a single individual, you have to have less than $2,000 in assets and you need to have income below around $2,300 a month. If you have more in assets than $2,000, then we can help you plan for how to qualify. And it doesn't mean just spending things down, and it definitely doesn't mean just giving things away. So sometimes people will come into our office and they're in a real pickle because they've done something like pay for their grandchildren's college tuition. And so around this time of year, whenever the kids are going back to school, sometimes they need a little bit of help. Under Medicaid rules, there's a penalty for giving away what they call transfers for less than value, or what most people call gifts. So say that I have $50,000 and I need to get down to 2,000, I can't just take that $48,000 difference and spread it around to my kids or give it to friends or even give it to somewhere like a church. Whenever we start talking about proper spend down, a lot of people just think that it means we have to get rid of the money. The real scary part about getting rid of the money is that once you get rid of it, it's gone. And so we want to make sure that whenever we're qualifying for these benefits, we're still keeping a healthy nest egg, a way for the family to be able to pull from different funds to help support things that even Medicaid doesn't cover. As you guys can imagine, even if you're on Medicaid, there's a couple things that aren't covered. The big things are vision issues, hearing issues, and dental issues. And so they are covered to a degree, but not often covered to the way that we want our loved ones to get that care. And so by keeping some of that extra money set aside, still qualifying for Medicaid, there's a pool for us to draw from, not only for those three things, but also for other couple things that pop up. There are a few exemptions to that $2,000 limit. One of the biggest ones that people always question is funeral expenses. And so, how do we bury somebody or how do we go through cremation if we only had $2,000 to start with? The good news is that under the Georgia program, you're allowed to keep up to $10,000 outside of that $2,000 if it's designated specifically for the right type of burial. There's a couple other things, such as one individual car. A lot of people, whenever they're coming from their home straight into a skilled nursing facility, we're independent. We know that around Georgia, it's hard to get around without a vehicle. And so you're not going to be penalized for having that vehicle whenever you go into the community. There are some confusing parts about what happens if you own a home. And again, in this instance, we're talking about if you're a single individual and you own a home, and that home is just in your name. The house, as long as it's only worth about $500,000 or less, doesn't prohibit you from qualifying for Medicaid. But it has a very scary part that people misunderstand about that, where they will actually come back and put a lien on your property, what they call a state recovery, where the state will get reimbursed if you sell the house or whenever you pass and that house is transferred to your heirs. It may actually force the sale of the home if it's the only asset that you had. Some other things that are going to be exempt are certain life insurance policies, again, with limiting thresholds, as well as the ability to be able to pay any kind of medical debts that you may have. A lot of times, whenever people go to a skilled nursing facility, the way that they end up there is through a fall or a stroke or some kind of event that has happened through the emergency room. And again, this is why Medicare and Medicaid get confused a lot. Say that you have a fall and that fall causes you to go to the hospital because you've broken a hip. While you go to the emergency room, that's covered under your Medicare. You need to be admitted for at least 3 days before Medicare covers part of rehab. During that 3 day period, sometimes hospitals now will try and play a game where they just have you under observation rather than being actually admitted. If this is you or your loved one, it's imperative that you make sure you are qualified as admitted and not just under observation in order for the next part of your insurance to kick in. At that point, there's somebody at the hospital called a discharge planner. It's usually a social worker that's going to help coordinate your move from your hospital room over to a rehab facility. Whenever we start talking about that rehab facility, that's usually just a nursing home, but in a different side of the place. So some of the beds are what's called long-term care beds, and some of the beds are rehab beds. The rehab beds can be paid for by Medicare. Most people, depending on what kind of supplements or Medicare programs they have, get 20 days of coverage. After 20 days of coverage, somebody's going to sit down with you or your family member and have a very stern talk about how we either need to start paying a copay for the next 80 days, or we need to take somebody home to an assisted living or move them over to the long-term bed part of the community. Whenever we start talking about what that looks like, it's really important that you have somebody in your corner that's advocating for you through that process to make sure that your loved one is in enough at the place that they need to be with the care they need to be, and you're doing it as stress-free as possible on a caregiver. After you switch over to that long-term care bed, there needs to be an application put in for what's called Medicaid. I strongly suggest that if you are over the threshold of $2,000 for an individual, that you reach out to somebody to help you through that process. Sometimes the business office at the community will go ahead and put through an application for you, but because they don't know all your circumstances, it can result in a denial. Often families that get a denial through Medicaid feel like that's the final answer and then continue to private pay until they run out of money. One of the problems with this is, like we talked about before, say that I had $50,000. I'm putting an application through the business office at the community, and I receive a denial letter somewhere around 10 days later. At that point in time, because it's a very official letter and it looks like I've done everything I could do and it was denied, I might just pay down the rest of my $48,000 until I completely run out of money. And if I do that, the problem is, like we discussed before, there's no pot of money to pull for if I need something with a new hearing aid, dental work. Maybe I just need a more comfortable pillow than what the state deems necessary. Whenever we start talking about options for somebody that's received a denial, it's always stressful because they've already received the denial. Now the community's asking for money. And remember, that money that they're asking for is somewhere around $260 to $300 a day. So that first bill that you get after the denial is probably somewhere around $8,000 to $9,000. That's pretty scary for most families, especially if we're talking about families that don't have a lot of resources to begin with. One of the things that we haven't covered yet is if you are healthy, but your spouse is going through this process. The good news is that if you're a married couple, you're allowed to have considerably more money. You're allowed to have almost $129,000. Why the big jump? Because remember that if it's just you, you're single, they're just trying to support your costs, and Medicaid will cover nearly everything. So you don't need a whole lot of resources in order to take care of yourself. But if you have a healthy spouse at home, we want to make sure that they're not what's called impoverished, or that they're going through a different quality of life or running out of money, so that whenever they need to live or they go through some kind of the curveballs of life, that they have resources to be able to support themselves as well. Just because the amount of money is a lot bigger doesn't mean that there isn't something that we can do to plan there. Remember, we still have the issue with the home where they could put a lien on it. We definitely have some issues with things like retirement funds, especially if you're heavily invested in things called annuities, which is a specific insurance product that a lot of seniors get themselves into to try and get an income stream. And often, whenever we start talking about having a spouse go into the skilled nursing facility, people are very worried that they won't have money to live on. Generally, even if your spouse goes into the skilled nursing facility, you get to keep almost all your income and sometimes even a portion of your spouse's income. There's some limits there, but it's enough for people to get by on. A lot of times, there's rumors that go around that they're going to take all your money. They don't do that. You just need to plan in advance for it. And that brings me to the question that a lot of people ask: when should I start planning for this kind of stuff? It's a question I get a lot, and I want to be clear there's no true answer for it. Unfortunately, I have clients that range all the way from 106 down to 31, and neither one of them thought that they were going to have the problems they have at those ages. The real answer is you need to plan at least 5 years and a day prior to you getting sick. But since we don't have a crystal ball that works, it's a good idea to plan as early as you can. The earlier you plan, the more protection you have going into these programs. Like we talked about, because you can't give gifts away, they look backwards. It's not just that I could give everything away here in August and in September I can qualify. They look back over all your financials for 5 years to see if you've ever given away any kind of gifts, money, sold things for less than value, especially at less than arm's length transactions. We really get people that get kind of swept up in this. If you've given people a car, maybe a grandchild, tuition is always a big one this time of year. And sometimes it's just something like helping a daughter out that was going through a divorce or helping a child put a down payment on a home. Those are all gifts that are not excluded through Medicaid. One of the biggest confusions that people have is that because the IRS doesn't require you to file a gift tax return for gifts less than $15,000 a year, that you can also do that for Medicaid. And unfortunately, that will get you in a really quick bind. For every around $6,000 that you give away, Medicaid will not pay for your care for 1 month, which means that you really just cost yourself somewhere in the neighborhood of $8,000 to $9,000 for that gift. Where this becomes a real problem if you don't plan for it is that later on down the road, if you need to go back to a lot of these people that you've given things to and ask for the money back because you need that money for care, it's just not a possibility. They've already spent it, they've already given it away, they just don't have access to it. Think about it: if somebody handed you even $10,000 right now, does that just go straight into savings? Most people are going to spend that on something. Maybe it's a vacation, maybe it's paying off some debt, maybe it's doing something fun. I don't know, but most people couldn't give you that money back in a couple months. And because of that, gifting is a real dangerous strategy unless it's done with care. I think that we've gone ahead and opened up a lot of questions here. We'd like for you to join us next time whenever we go live again. We're going to start this series every Wednesday at 3 o'clock in order to be able to go through, answer any questions you have. We suggest any topics. Please begin to send them over to us at info@nelsoneldercarelaw.com or shoot us a message through Messenger.